Example of what a therapy session for the WH question, what, would look like. So the subject will be asked the what question. For example, what do we do with scissors? Then I will expect the subject to repeat the question, and then I will state, answer the question, and they will answer the question correctly. All right? So it will move fast in this video, but go as slow as possible or as needed when you're working with the student. What do we do with scissors?
What do we do with scissors?
Now answer the question.
We cut with scissors.
Good. What do we do with tissues?
What do we do with tissues?
Now answer the question.
We blow our nose with tissues.
Good. What do we do with a phone?
What do we do with a phone?
Answer the question.
We call people on the phone.
Good. What do we do with pizza?
What do we do with pizza?
Answer the question.
We eat pizza.
Good. What do we do with a pen?
What do we do with a pen?
Now answer the question.
We write with a pen.
Good. Now as you notice, I'm having the subject repeat the question in a manner where it's exactly correct. And then I'm waiting for them to say it completely. And once they've repeated it, I have them answer the question. So they're having to state it out loud, work on their articulation so they're understood when asking the question, and then also then they're thinking about how to answer the question at the end of it. So, for example, what do we do with a pen? Then the student will say, what do we do with a pen? And then prompt, answer the question now. Well, then they have to think in their head, well, what do we do with a pen? And if they can't think of it, give them a prompt. Help them out a little bit. Give them the hint that, well, what do you do with a pen when you're doing homework? Do you use a pen to scratch your arm, or do you use a pen to write on a piece of paper? And that, providing two choices like that, will then give the student the ability to answer correctly, which is obviously writing on a piece of paper with a pen.